Hey, it's Dr. Lowenstein again, and I want to talk to you today, I think once again, because it seems like I've covered this in the past, but there seems to be a lot more questions about why sometimes a nerve block causes more pain than it helps. There's a couple of issues here. Number one, when I do my nerve blocks, I'm just using local anesthesia. So if local anesthesia is the only thing that's being used, the nerve, when it's bathed in this local anesthesia, the needle gets put next to the nerve, the local anesthesia goes out and affects the nerve, shuts the nerve down, and the pain gets better. If you're using steroids, however, steroids they don't work immediately. They decrease inflammation over a longer period of time. They do some other things as well that are not that awesome, but that's the concept of using a steroid for a nerve block. So what happens is when you inject that steroid, the steroid in the acute sense is an irritant, okay? Meaning that when you're actually pushing the steroid in through the needle, it's going to irritate the area where it's injected before it makes things better. So that irritation is going to make the nerve more angry and often going to exacerbate your headaches. So, but the good news is that if you get an injection that makes your pain go away, you're very likely a good candidate for nerve decompression or migraine surgery, which is, again, what I do. If you get an injection and it makes your pain worse, that still means that you're likely a good candidate for migraine surgery, or it's also called nerve decompression, because what we're seeing there is that the irritant is bothering the nerve, making the nerve angry, and that is making your headaches worse. So we know then that your headaches are actually caused by angry peripheral nerves. The nerves, the occipital nerves usually, the supraorbital, supratrochlear nerves, but these kind of nerve blocks are most often done in the neck back here. So if either your pain gets worse or gets better, it's likely I can make your pain much, much better in a long-term situation. If you don't have any change, then it's a less clear situation. But even in those cases, I strongly urge you to get an injection from a migraine surgeon who knows where the nerves are. Too many times, the problem is actually that the neurologist or the pain doctor, they do nerve blocks, but they don't actually know where the nerves are, because when I do a nerve block, I do it based on seeing the nerves all the time in surgery. I know where they run. I don't know how deep they are. A lot of times these injections are not done deeply enough. And so if it doesn't do anything, look into getting another injection maybe by somebody else. I've seen so many of my patients have had no luck with previous nerve injections, and then I do a nerve block and it takes care of it. But again, I want to clarify the reason that we see a lot of people in more pain from the nerve blocks is that just the local irritation of what's injected bothering the nerve. And it's unfortunate, but it kind of justifies the cause of your problem. The cause of your problem is that peripheral nerve. And we can fix it on a more permanent basis with outpatient procedure. 93% of the time, it gets better. 40 to 45% of the time, it goes away altogether. So anyway, if you want more information about what we can do, if your nerve blocks are either highly successful or highly disastrous because they're causing more pain, check out the rest of our website at headachesurgery.com. But I hope that helps clarify the situation. Okay, take care.